Let's talk, though, to Dr. John Dean, because the Royal College of Physicians has called for a zero-tolerance approach to NHS corridor care. We found out last week that many people in this country now go to a hospital and they spend quite a long time in a corridor because there aren't enough beds for them to get into. Dr. John, a very good morning to you. Thanks for joining us.
Morning.
What does zero-tolerance mean when it comes to corridor care? Just that it shouldn't happen?
Yeah, it shouldn't happen in a modern health service. But the reality is we don't actually know the size of the problem because we don't know how many people who've been admitted to hospital are either in a trolley on a corridor or in or an extra patient on a ward without the normal bedside facilities, or potentially another area like a gym or something that's been converted into a temporary ward. But we don't know the size of that problem because the NHS is not measuring it and the NHS is not reporting it. Until we know the size of the problem, we won't know whether we're improving the situation or not. And there are clear things that we can do to improve the situation. So a zero tolerance means we know the size of the problem, we're doing things about it, and we're tracking that it's improving so we can eliminate it.
Do you think they're not reporting it because they kind of would rather it wasn't paid attention to, or they'd rather pretend that it didn't exist?
I think they're not reporting it for a number of reasons. Firstly, when we report anything, we've got to be really clear what the measure is, that it's an accurate measure. It's something that historically we didn't think would be happening, so we haven't set up systems to measure it. We're reassured to a degree that NHS England have asked Trust to start measuring it. We haven't seen the definition of that measure because we want to know all the people who've been admitted to hospital who are not in a bed space with the facilities that you would expect. The ability to call a nurse, able to get a drink, turn the light off at night so you can sleep, your medicine's easily available for you, monitored in case you're deteriorating. All of these things need to be there for every patient that's admitted to hospital. And that's what we're putting really clearly in our guidance. What are the basic standards that every patient admitted to hospital has? And when you're in extremis, yes, you may have to very occasionally take these measures, but you still got to make sure those things are in place for patients to keep them safe. But it's not in extremis now. This is commonplace. This is happening all year round in every hospital almost in this country.
And what do you think is the answer? And I know that's quite a complicated question probably for you to have 2 minutes to answer it. But I mean, is it simply putting more beds into hospitals? Is it simply expanding the size of the wards?
It's multifactorial. I mean, the issue, 1 in 8 patients who are currently in acute hospitals don't need to be in acute hospitals because they've recovered adequately from their acute care, but the community or support facilities and social care are not there for them. So if we were to free up 1 in 8 beds, we would not be having patients on extra beds or in corridors. So that's where the effort has to go. But there are a series of processes within hospitals that can help, and that we need to just tweak every bit of the system so that patients are getting timely care throughout their stay and then getting home when they're ready to get home. But if 1 in 8 patients who are in hospital don't need to be in hospital because they've recovered adequately, then when we know the numbers, I suspect it won't. It will be within that 1 in 8 that we could get in. There is, in the way the current system's working, we need more beds and more staff, but the predominant issue is getting people out of hospital when they're well enough to get out of hospital.
Sure. That seems to be a really key thing. Dr. John Dean, thank you very much indeed. Clinical Vice President of the Royal College of Physicians.